his doctor and says, "My wife is going into labor. What should I do?" The doctor says, "Is this her first child?" The husband replies, "No, this is the husband." Thank you so much, thank you so much. A man goes to his doctor and tells him, "Doc, you gotta help me, man. I'm addicted to Twitter." The doctor replies, "Sorry, I don't follow you." Hi everybody, it's Dr. Ryan here again with another hard-hitting algorithm in internal medicine. Thank you so much for joining me. Thank you for those who have been liking and sharing my videos and subscribing to my channel. And if you haven't done so, what are you waiting for? Anyway, today allow me to introduce to you our 35th algorithm in internal medicine and our third in the discipline of gastroenterology. Today we're going to be breaking down ascites. So, ascites is the abnormal accumulation of fluid within the peritoneal cavity. Symptoms of ascites include increased abdominal girth, abdominal fullness, abdominal discomfort, dyspnea, early satiety, and a sense of decreased mobility. Physical findings of ascites include abdominal distension, bulging flanks, shifting dullness to percussion, and the presence of a fluid wave. Now, ascites can be related to portal hypertension, in which case, we quantify the serum albumin acidic gradient, and if that gradient is in general greater than or equal to 11, we say that the ascites can be attributed to being due to portal hypertension, or it may be unrelated to portal hypertension, in which case the SAG is below 11. Portal hypertension, as we know, can be prehepatic, intrahepatic, and posthepatic as per the algorithm, and ascites unrelated to portal hypertension can be protein poor or protein rich. Now, acidic fluid analysis, including the gross appearance, cell count and differential, total protein, gram stain and culture, cytology, and other ancillary tests can be helpful in ascertaining the etiology of the ascites. In addition to addressing the underlying cause, management of ascites includes salt restriction, diuretics, and large volume paracentesis. All right, so let's get stuck into this algorithm. We said broadly we got to firstly quantify your serum albumin acidic gradient, right? Which is the albumin in the serum less the albumin in the acidic fluid, and if it's greater than 11, we said that most likely we are dealing with a situation of portal hypertension, which is further stratified into pre, intra, and posthepatic causes. So prehepatic, we're talking about stuff that happens before the liver, okay? And to that effect, we speak about portal vein thrombosis, splenic vein thrombosis, any extrinsic compression, and splanchnic AV fistula, okay? Intrinsic hepatic causes of portal hypertension include cirrhosis, which is probably the most common cause. All right, infiltrative disease, acute liver failure, primary biliary cholangitis, primary sclerosing cholangitis. It could be idiopathic portal hypertension or sinusoidal obstruction syndrome. Posthepatic, of course, happens after the liver, and probably the most common cause of this we see in our clinical setting is heart failure, together with constrictive pericarditis. And the big clue to big clue to constrictive pericarditis is the fact that we have usually ascites, which is out of keeping with peripheral edema. Okay, Budd-Chiari syndrome, which is essentially hepatic vein thrombosis, and inferior vena cava syndrome. All right, then going over to the scenario where your SAG is below 11, then we speak about non-portal hypertension, which is further stratified into protein rich and protein poor. So protein poor, we think about things like nephrotic syndrome, malnutrition, protein losing enteropathy, versus protein rich, where we're thinking about probably a malignant process or something infective or autoimmune, like pancreatitis fits in there, TB, hemoperitoneum, chylous ascites, mixed edema, or perforated viscous, right? So that gives us about 10 causes of non-portal hypertension associated etiology, about 16 portal hypertension associated etiologies, giving us a whopping 26 causes of ascites, right? This is a fun mnemonic, which is here courtesy of the guys over at drgohari.com, right? A nice, easy way to remember conditions that precipitate hepatic encephalopathy. The mnemonic here is hepatics, right? Very nice. So H speaks to hemorrhage into the GIT, and your clue there is usually the urea is disproportionately high in comparison to the creatinine, right? Because the blood in the GI tract is being metabolized by the intestinal bacteria. Okay, excess protein in the diet, potassium depletion, restricted diuretics, specifically furosemide and hydrochlorothiazide, alkalosis or azotemia, yes, even that can precipitate encephalopathy, trauma, infection in the way of bacterial peritonitis, which is common, especially in patients who have cirrhosis, and complicates ascites in that clinical situation, constipation or colon surgery, and sedatives, especially injudicious use of sedatives, right? Another handy mnemonic is alcoholic liver disease, where you think about the mnemonic DAMP pages. Nice one. So D is discomfort in the abdomen, A stands for ascites or alcohol toxicity, M is muscle wasting, all right? P is pulmonary erythema, portal hypertension, and polyneuropathy. Yes, those are all sequelae of alcohol. Prolonged prothrombin time, which speaks to diminished synthetic function of the liver, abdominal pain, and diminished albumin. G for gynecomastia, E for elevated AST and ALT, which are your transaminases. S for spiroangiomata. Another handy one is portal hypertension, and the features of it is A, B, C, D, E. A stands for ascites, B for bleeding in the way of hematemesis or piles, C for caput medusae. Right? These are the three cardinal features of portal hypertension, at the anastomotic junctions. All right. D stands for diminished liver in terms of liver atrophy, and then E for enlarged spleen, speaking to splenomegaly. Okay. So this is just something to keep it fresh and exciting, taken from the Mayo Clinic. A 70-year-old man who is an alcoholic is admitted to the hospital with diffuse abdominal pain and confusion. He has a history of hematemesis. If he continues to drink alcohol, what is his chance of 5-year survival? Well, obviously you can see this gentleman has ascites and he has a history of alcoholic use, so most likely cirrhosis with portal hypertension and he has varices, right? In that he has bleeding esophageal varices, probably the cause of his hematemesis. So the answer here is actually D, 34%, right? So just a little bit about cirrhosis of the liver. History and physical examination evidence for portal hypertension due to cirrhosis of the liver include jaundice, hematemesis, ascites, gynecomastia, and encephalopathy. Diffuse abdominal pain in the presence of ascites suggests spontaneous bacterial peritonitis. That is a big clue. Women are more prone to alcoholic cirrhosis. Liver enzymes may be normal. Hepatitis C viral infection is common. Liver transplantation is allowed if the patient maintains abstinence from alcohol. Now, this is the money-throwing moment, right? The 5-year survival rate of patients with alcoholic cirrhosis without ascites, jaundice, or hematemesis and who abstain from alcohol is 89%. The 5-year survival rate of patients who have alcoholic cirrhosis with ascites, jaundice, or hematemesis and who continue to drink alcohol is 34%. All right, nice one. Okay, as always, I just have something to encourage you with. Today I want to speak about the topic of wisdom. I once had a tutor who said that you'd rather ask a question and seem to be a fool for 5 minutes than not ask a question and be a fool for the rest of your life. Socrates says that the only true wisdom is knowing that you know nothing. And Aristotle goes on to say that knowing yourself is the beginning of all wisdom. But my blueprint for living is looking at the Bible. And what does the Bible have to say about wisdom? I'm just going to draw 3 scriptures. Psalm chapter 111 verse 10 says that the fear of the Lord is the beginning of wisdom, and all who follow his precepts have good understanding. James 1:5 says, if any of you should require wisdom, let him ask of the Lord, who gives graciously to all without finding fault, it shall be given you. And James again, chapter 3, verses 13 and 17. Verse 13 says, who is wise and understanding among you? Let him show it by his good life, by deeds done in the humility that comes from wisdom. Verse 17 goes on to say, but the wisdom that comes from heaven is first of all pure, then peace-loving, considerate, submissive, full of mercy and good fruit, impartial and sincere. Peacemakers who sow in peace raise a harvest of righteousness. So I hope that you have been encouraged through today's video. We're going to be addressing another topic in gastroenterology tomorrow. I'm looking forward to seeing you then. Take care.